Coming to the pharynx, pharynx has three parts: nasopharynx, oropharynx, and laryngopharynx. Nasopharynx extends from the base of the skull to the soft palate. Oropharynx extends from the hard palate to the hyoid bone. Laryngopharynx extends from the hyoid bone to the lower border of the cricoid cartilage. Coming to the inflammations or infections of the pharynx. Pharyngitis is of acute type and chronic type. Acute is due to bacterial infections, viral, fungal, and miscellaneous. Viral infections are like rhinoviruses, cytomegalovirus, infectious mononucleosis, herpes simplex, or following infections like measles, chickenpox. And bacterial are like streptococci, diphtheria, and fungi like candida and chlamydia, and miscellaneous by parasites like toxoplasmosis. And the clinical features are based on the severity. There are three types: milder, moderate, and severe. In milder, it is due to viral, and moderate and severe, it is due to viral or bacterial. Severe, it is mostly due to bacterial. In milder acute pharyngitis, there is discomfort in the throat and fever is low-grade type. In moderate and severe, there is dysphagia and high-grade fever. On examination, the pharynx is congested in milder and there is erythema and exudate. As it is moderate and severe, there is exudate also, and lymph nodes are enlarged here and lymph nodes are not enlarged in the milder. In severe cases, uvula and soft palate are also edematous. Treatment is general measures and specific treatment. General like bed rest, plenty of fluid and saline gargles, and specific treatment like for streptococcus it is penicillin or benzathine penicillin. If it is penicillin sensitive, erythromycin, and for diphtheria it is antitoxin, and gonococcus penicillin. Coming to chronic pharyngitis, it is due to smoking, alcohol, environment, or persistent infections from neighborhood like sinusitis and faulty voice protection or mouth breathing. And symptoms are discomfort in the throat, more in the mornings, and tiredness of voice, foreign body sensation, and cough. It is of two types, catarrhal and hypertrophic. In catarrhal, the posterior pharyngeal wall is congested, and in hypertrophy. So there are nodules are formed, they are reddish, and uvula is also elongated and edematous. Treatment is by treat the cause and by giving voice rest, speech therapy, saline gargles, and as there are reddish granules, they are cauterized. And Mandel's paint is applied to the pharyngeal mucosa to prevent hypertrophy. Mandel's paint is applied to the pharyngeal mucosa. Apart from acute and chronic pharyngitis, there is also keratosis pharyngitis. It is the hypertrophy and keratinization of epithelium. Keratosis itself indicates keratinization, it is hypertrophy, and keratinization of epithelium. White and yellow dots are seen on the tonsil, posterior pharyngeal wall, and tongue. Coming to the nasopharynx inflammations, it is of four types: acute, chronic, thorn wall disease, and adenoid. Acute infections are due to upper respiratory tract infections, and clinical features are dryness and burning sensation in the above the soft palate. Coming to chronic infections, it is due to sinusitis or irritants like dust and fumes. And clinical features are postnasal discharge and crust, and treatment for this is alkaline nasal douche to remove the crust and steam inhalation. Coming to thorn wall disease or pharyngeal bursitis. Pharyngeal bursa is a median recess in the posterior wall, in the midline of the posterior nasopharyngeal wall. It is due to the attachment of notochord to the endoderm. during embryonic development, attachment of notochord to the endoderm. Clinical features are postnasal discharge and crush, eustachian tube and nasal obstruction, fever, low-grade fever, sore throat, headache in the occiput region. On examination, there is fluctuant swelling, the posterior wall of the nasopharynx, and crush. Treatment is by antibiotics and marsupialization of swelling and removing its membrane. Antibiotics and marsupialization of swelling. Coming to the adenoids.